But Canada is nearing a grim milestone in the coronavirus pandemic. Almost 10,000 people in this country have died, and the number of cases is rising at an alarming rate in the most populous provinces. Quebec has the most cases, 963 today, and it's reporting 19 more deaths. Yesterday, the provincial government extended restrictions in red zones for another 4 weeks. Ontario has 827 new cases and 4 deaths. Officials are blaming large gatherings and Thanksgiving get-togethers for the recent spike in numbers. Hospitalizations are up, and the number of tests being done has dropped in recent days. The Atlantic bubble continues to be a success story with just 3 new cases in New Brunswick and 1 in Nova Scotia. The North reported 2 new cases yesterday, both in Yukon. Manitoba set a record for daily cases today at 184. The province also saw 3 more people die of COVID. Saskatchewan is reporting 58 more cases. Now we're expecting updates from health officials in Alberta and British Columbia soon. We'll bring those to you when we get them. Yesterday, however, both provinces reported record or near record numbers from the weekend. Alberta is lowering the number of people who can gather in Calgary and Edmonton to just 15. BC is restricting the size of gatherings in private homes. And BC Provincial Health Officer Dr. Bonnie Henry says it's an expectation, but not an order, that people wear masks in public. Now, many provinces have postponed or cut back on non-essential surgeries during the first wave of the pandemic in order to preserve hospital capacity for COVID cases. Now they're dealing with a huge backlog of patients waiting for a medical procedure. A study by the Canadian Medical Association estimates that over 300,000 procedures would need to be performed over a 12-month period to catch up. But the organization says without immediate government help, the backlog might only get worse. For more on all of this, I'm joined by CMA President Dr. Ann Collins in Fredericton. Dr. Collins, thanks for joining us.
Thank you for having me.
I'd like to start with the current status of the pandemic. How concerned should we be that these rising cases could overwhelm the health system?
I think that we have a real cause for concern here. As we have outlined by having this study done and seeing what the effect of the first wave of the pandemic was on 6 procedures only. There is a great deal of concern here. We have seen that this backlog has increased people's wait times for joint replacements, for cataract surgery, for heart bypass surgery, and diagnostic procedures like MRIs and CAT scans. And if we end up in another period of time where there is a pause put on all of these procedures, it will have the worst effect ever on impact on wait times in Canadian healthcare history.
You know, while that is obviously a concern, we are seeing a number of provinces with record cases or near record cases, and they are in part blaming social gatherings and COVID fatigue for the recent surge. And we saw the Prime Minister today express his own bit of COVID fatigue, saying all of this really sucks, to use his words. Do you think government and health officials need to adjust their messaging to address this fatigue and avoid that very backlog scenario you're worried about?
I think that we need to continue to follow what is put out there by our public health experts and to continue to keep in mind as Canadians that we have a very fragile healthcare system. It was fragile prior to the pandemic. And as this study has outlined, our ability to respond to the care needs of Canadians not related to COVID disease is compromised now. And this will only worsen if we do have the full effect of a second wave.
But so what do governments, at all levels, we're talking provincial, local health authorities, federal health authorities, what do they need to do to get greater levels of compliance with this basic health messaging? Because if you look at the numbers, you look at some of the horrific stories we're hearing about, like parties with hundreds of people at them in a single house, people clearly aren't abiding by it. So how do we get people back on the track that allowed us to flatten the curve going into the summer?
I think we just have to keep persisting with the messaging, look at innovative ways, just as we do within our healthcare system, look at innovative ways to reach certain populations. We know that our youth respond differently to media that or mediums that our older population do not. It's to just keep delivering that message and imploring people to think of not just themselves, but all Canadians. We are all vulnerable to this virus.
Quebec has extended restrictions in their hotspots for another month because of the case levels there. Do you think the current restrictions are going far enough, considering we keep seeing these high number of daily new cases?
I think that really that's a question that at CMA we have relied upon public health, best science and evidence that public health can provide to this conversation to guide governing bodies, those bodies that are in the position that need to make those decisions.
So your organization has released a study yesterday, you've referenced this earlier, showing that the backlog of procedures and surgeries that were canceled early on in the pandemic, it could take a year to clear up. How confident are you that that can be avoided given what we're seeing with these rising cases? Because if this keeps going the way it's going, it's going to sideswipe an already existing problem.
Well, the fact of the matter is if we don't start bringing backlog into the conversation around this pandemic, we will not see much progress made. And that's what we're calling for here, really. And the ask that we've made of government is that they start having conversations federally and provincially about how to address this backlog, how to reassure those Canadians living with chronic pain due to arthritic joints that their healthcare needs will be met as well.
Right. So one way to clear backlogs is to throw resources at it, to find more resources. I know you've suggested that maybe it'll take $1.3 billion to deal with this. How will that cash injection help? And who should that come from? Is that a federal government request? Does that need to come from Ottawa?
We know that provinces will need to meet this backlog demand, will need an extra 15% allotment of funds to tackle this very imminent problem for many Canadians. It's also an opportunity, though, for us to talk about how we deliver healthcare. We're operating in a system that was really designed in the 1960s. Mm-hmm. We need to modernize. We need to be innovative. We need to look at how we deal with wait times. Not just during a pandemic, but even long into the future. This is not a problem just now. It's going to continue for a long time, but we want to start having those conversations to address that. That's why we've asked the federal government to look at establishing an innovative healthcare fund so that we can tackle some of these really serious issues in our system.
If the money doesn't come, Doctor, how long could we be looking at before this backlog can be cleared?
We could very well see a backlog on a backlog if we do not start addressing it, given what we are very possibly looking at with a second wave.
Okay. Dr. Ann Collins, thank you so much for your time.
Thanks very much for having me.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.